Hi, we're introducing a new way of doing morphogenic field technique, and we're calling it integrative testing. And the purpose of doing integrative testing is to make morphogenic field technique fall more in line with what muscle testers are used to doing in their practice. Because morphogenic field technique was unique in that when you found an attraction to one of the vials in one of our test kits, the muscle would stay strong. Most muscle testers in every other discipline are used to looking for weak muscles first. And because we were a little different, that was a problem for some people to say, well, I don't get the weak, strong thing. So the purpose of filming this video is to show you that there is an alternative. We call it integrative testing or reverse testing. And because the field is either going to be attracted or reject an energy, that's the main thing you want to take into consideration, is not what happens to the muscle so much as how do you interpret that. Is that an attraction or is that a rejection? So we want people to understand that there's other ways of doing it, because the field is dynamic. You don't have to do it one way or another. The reason we have always brought the kits into the field is because that's how we measure the field. So when we take our simplex M or simplex F and do our field measurements, we have brought that into the field. That's the only way we can do it and get an accurate field measurement reading. But we followed that through, and so in classic MFT we brought everything into the field. So now with integrative MFT, the rules are just reversed, except for when you test the field and also for when you're using the kits. We're still trying to identify attractions based on strength when you use the kits. So this doesn't change, and how you use the kits does not change. The only thing that changes is how you determine whether there's an attraction or a rejection. So we're going to give you a little demonstration. We have Asia here. Now Asia, come on into the picture. And Asia works in our office, and she is on a parasite protocol, a detrimental 1, was it? Do you know?
I don't know.
Okay, so she's a patient of Dr. Stamper. He's the my associate here in our office. And currently she's taking wormwood and she's taking Cataplex AC for this, and she already took that today, so we don't expect that to be showing up. So what we're going to do is we're going to start by measuring her field and see what it is. And it's right about here, so that's out about 4 feet. So when we get all done, we're going to remeasure, because we don't have enough room here to measure all of the fields. We're going to stay with this. Okay, so now we know the field, we brought it into the field, but now to do our integrative testing, we're going to take the red kit and we're going to place that up against Asia, and we're going to pull it away. And there's no attraction here. Her body is not interested because the muscle stays strong. It does not go weak. We're looking in this way for a weak muscle. Now we turn the kit over and pull it away, and there we do get an attraction. So in this case, using integrative testing, the attraction is the weak muscle instead of the strong muscle. So we do it in the same way. Now we're looking for what's strong. So we're going to have her touch, and we'll see what it is. Is it sugar handling? And the answer is no. Minerals, no. Autotoxemia is a yes. And then we scan down like we do in our normal procedure, and it's Spanish black radish. So we're going to take some Spanish black radish and we're going to put that into the field. And now she's holding Spanish black radish, and we're going to pull it out again. Now it's not interested because she's already holding the Spanish black radish. So we can go on to the next phase, which is the cell energies, and we're going to see if we get an attraction here. Now remember, we're going to pull it out, and if it goes weak, that's the attraction. And it does not. So we're going to turn it around, pull it out again, and it does go weak. So now we're just going to scan, as we do in our procedure, all of the different areas. And it's down toward the bottom, and it's white blood cell 2. So you hang on to white blood cell 2. She's holding that. Does any other cell energies attract on that side? The answer is no, but I'm going to flip it back because white blood cell energy indicates that there's an immune challenge somewhere. So we want to see if the body is now willing to tell us what cell the immune challenge is, what cell area. So let's pull it away this way, and we get an attraction now on the first page of the white kit. So we're going to scan that, and we're going to see what we get. And we get a lymph energy. So white blood cell lymph. Now we got to find out what is the immune challenge, because we know we've isolated it to the lymph now. So now we go to the next step, which is the blue kit. And we put the blue kit up against her, pull it out, and we get an attraction here. So the next step is it Morph Stealth? No. Is it GMO promoter? No. Is it the two in combination? No. Is it a replicator? No. A scavenger? No. A proliferator? No. A detrimental? Yes. Is it a 4, 3, 2, 1? So she's showing for a large worm energy. So now we have to go, what we're going to do is we're going to go right to the Express kit, and we're going to see what the body has to say about solutions for that. So we have Zymex 2, and it's horse chestnut in this case. She's already taking wormwood and cataplex AC. Now she's holding Spanish black radish, and here is horse chestnut complex. Okay, so let's go back to the kit again, and we're going to see if we've got this covered for now. We're going to pull it out. Okay, now, as you can see, when we pull it out, it stays strong. If we take out the horse chestnut and we pull it out, there's the attraction back again. So it's going to be, we're going to add horse chestnut and Spanish black radish to her protocol on this visit. Flip on the other side of the blue kit, and that's fine. Now we're going to go to her fatty acid point. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and her fatty acids are covered. So let's remeasure her field. Now, in the integrative testing, you bring it into the field, just like this. So let's see where the field is now, and we are way out. It was about 4 feet, now we're out to about 6 or 7 feet. So let's dose, see how many she needs. Horse chestnut, 1 a day, and she'll be taking that at night, 1 when she goes, just before she goes to bed. 10 days on, 2 days off. Hold on to that. We're going to go to Spanish black radish. Now, this is what she's been missing right now with the detrimental protocols, is more drainage. So she needs more drainage. Spanish black radish. Lymphatics is where we're having our congestion based on the cell energies. And 1, 2, 3, 4. So we're going to add 4 Spanish black radish. Now, let's take these vials, and when we pull them out now, it stays strong. Okay, if we take away these protocols and we pull it out, we're going to get that attraction back. Now, one of the advantages of doing the integrative testing is you get to take advantage of the 3-year-old child response. Now, as you know from taking the basic seminar, the 3-year-old child response is when the field has what it wants and you take it away, it's like taking a toy away from a 3-year-old child after you've given it to them. They're going to get all upset about it. And so the field, when we take away the supplement that the body's been asking for, will also get upset about it. So, okay, so you got your protocol now? Mm-hmm. Okay, so thank you, Asia. Okay, so this is another option. So people who have been used to other types of muscle response testing can use integrative testing, integrative MFT testing. The classic testing is still good. So we have people who have been a little resistant to this introduction, and it's okay. It's okay. You can do it either way. The field works in both directions. You just have to understand what the rules are. And the difference is how you decide what the attraction is. The attraction in integrative testing is shown by pulling the kid away and the muscle going weak. In classic MFT, the attraction is shown by bringing the kits into the field and the muscle stays strong. Whereas in classic, if you were to bring the kid into the field and it wasn't interested, the muscle would go weak and say, not interested. Okay, so I hope this was a good explanation for this, for the people who are wondering about all the details of it. And feel free to give it a try and find out which one you prefer to use. Okay, so thank you for listening.